If PCOS is the name you've been used to, it now has a new term, PMOS. In this video, I'm going to be telling you the reason for the change, the cause of this disease, of this condition. I'm also going to tell you the symptoms of it and the solution. If you've not heard about PCOS or this new name, PMOS, don't worry, I've got you. So let's go right into this video. PCOS, what used to be called polycystic ovarian syndrome, has now been termed polyendocrine metabolic ovarian syndrome. Both of them are still mouthfuls, but the change has come because, as opposed to PCOS that just felt and recognized this as cysts in the ovaries, PMOS has come through many years of studies and research to see that this condition actually affects the entire body. It's not just about the ovaries. It's a condition that affects the metabolic system, it affects the mental well-being, it also affects the skin and then the reproductive system. So it's not just about the ovaries, and this has made some women to suffer in silence, suffer in denial, because this has just been restricted to a disease of the ovaries. But we've now come to see that it's a complex hormonal issue. It's a complex hormonal problem that affects all these areas that I have mentioned. What is the cause of this condition? PMOS, as it is now rightly called, is a condition that the cause is not yet well known. What we know is that insulin, a hormone that controls how the body handles glucose, becomes less sensitive to the cells of the body, because insulin is that hormone that makes the food you eat to go into the cells. When the food you eat is processed by a complex process, it is broken down to glucose. Your cells need glucose to work. And what will drive those glucose into your body cells is insulin. But then your body cells become less sensitive to glucose, which means that more insulin will be released to tend to drive the process, because the body is wondering, there's glucose, I'm starving, please insulin, we need more insulin. Insulin is not driving the glucose into the cells. This hand in hand now plays a role, because another group of hormones called androgens also now work, and these two processes affect ovulation, affects normal function of cells that bring about ovulation. This is in summary what's happened. But what is the exact factor, what is the exact thing that leads to all this coming up? That is what is still a mystery. Those polycystic I've even used the wrong word again. It will take some time to get to the new word. How does it manifest? You may find out that your periods are far apart. They are not in the pattern they used to be. Or it may even be that some people suffer this even right from the time their periods starts. The periods are not, you cannot predict, you cannot say, okay, this is every 28 days, or even a range of maybe, let's say, 26 to 30 days, 26 to 28 days, sometimes more than 35 days, more than 38 days, once in 2 months. And even when those periods come, they may be more heavier than usual, lasting more than a week or more. Some people also find that they have hairs growing in areas where men tend to have hairs, such as hairs under the chin, hairs on the chest, hairs in the upper part of the belly, hairs going from the pubic area going up to the belly. Some women also find that, may also find that your skin is more oily than usual, or you struggle with acne, what some people also call pimples. These are symptoms that may occur, or you may find in your about you. We've also found that in some women too, when an ultrasound scan is done, you may find that they have cysts. Cysts are like fluid-filled sacs. that, at about the same size, none of them is maturing enough to be released during ovulation. So this is seen as many cysts. And this is another reason why this name was changed, because some people just summarize this condition to cysts in the ovary, just something about ovarian cysts. But no, that is a manifestation of the complex hormonal interplay in your body. What is the solution to these symptoms? What is the solution to PMOS? Because for many women, there's anxiety around this dysfunction in the reproductive system, dysfunction in the skin. There's loss of confidence. Imagine having acne, using a lot of skincare products, and nothing much is happening. So it leads to anxiety. Some women are depressed, and then it's also a concern, it's a fertility concern. Some women battle with infertility because of this PMOS. So it's an area of interest, it's an area of concern. The thing is, there is no quick fix to solving PMOS because it's a complex, the causation is complex. The solution is also an interplay of certain factors, which I'll summarize as lifestyle modification and diet. Of course, there are medicines that your doctor may prescribe, but lifestyle modification, dietary changes, these are game changers in PMOS if you have been diagnosed with PMOS. They are game changers. For instance, about your diet, cutting out artificial sugars is very important. Artificial sugars drive inflammation, and inflammation, when inflammation becomes chronic, it can have far-reaching effects on your body, on your ovaries, on your blood vessels, a lot. So cutting out artificial sugars, cutting out goes a long way to help. Also, what are artificial sugars? Sodas, junks, cake, you know, um, those things that are not natural. They're not natural sugars. So they drive inflammation. Then replacing that with proteins, more of natural food, proteins, vegetables, those are better for your health. Also, exercise, weight loss, because being overweight or obese drives the insulin resistance up and also drives the androgen score. So weight loss, losing weight and maintaining healthy weight is such a key factor. And take note that weight loss has to be steady, on a steady pace. If there's a rapid weight loss, it also affects this interplay. Stress hormones, those come up too and also complicate matters. So it's important that exercise is at a steady pace. You need to bring in discipline, you need to bring in consistency. What is advocated? 30 minutes of exercise per day for 5 days. So that on the average, you're having 150 minutes of exercise per week. So you incorporate this with healthy diets, healthy lifestyle, to bring about that change. Over a couple of months, when this is sustained, it brings about that change that even in some instances, medications may not give you. Some people have talked about supplements such as CQ10. CQ10 is said to be a fat soluble vitamin that can help to reduce oxidation around your ovaries and reduce damage, oxidative stress to your ovaries. Studies are still going on to establish the efficacy of these nutrients in helping people with PMOS, but more studies need to be done. But so far, small studies here and there have shown that it's helpful. It reduces insulin resistance, reduces um, makes the body more amenable to glucose control and handling glucose well, which all in all has an effect on the functioning of your ovaries in the long run. More so, in conclusion, I want to emphasize the importance of PMOS being controlled, being taken care of, because It is a long-term risk factor for things, metabolic syndrome, things like cardiovascular disease, things like diabetes mellitus type 2. So this is not just noise, it is an awareness video for you to be informed and empowered. So if you have any questions, drop them in the comment section. I'll see you in the next video. Share with your loved ones and everybody you need to know about PMOS. Bye.